We know that social factors affect health, but knowing isn't the same as bridging gaps in care and health outcomes. That's why the Department of Health and Human Services published the U.S. Playbook to address social determinants of health. Today on Quality Matters, we speak with the Playbook's lead author, Dr. Sandra Ford. A pediatrician and longtime advocate, Dr. Ford led public health efforts in DeKalb County, Georgia, and served in the White House. Sandra Ford, thank you for joining us on Quality Matters. We appreciate your being here.
I'm happy to be here.
You have deep experience in public health at the local level in Los Angeles and in the Atlanta region. And you were at the White House from 2021 to 2023, where you were a principal author of the U.S. Playbook to address social determinants of health. What's the backstory on the Playbook and why is it necessary?
The Playbook came about from some of my experiences at the local level. Chronic disease issues are not going to be addressed by doctors alone, by healthcare alone. We're not going to doctor ourselves out of the healthcare crisis. Particularly during the pandemic, folks who were housing insecure, who did not have appropriate nutrition, who, were isolated and didn't have transportation, were the ones that had the worst outcomes. And I can give you a prescription for insulin, but if your basic diet is poor, it's not going to help you. And so we're looking at housing, we're looking at food, we're looking at, educational opportunities, job opportunities, social context. Are you isolated? Is there anyone there to check on you and make sure that you take your medicine? Do you have transportation? In a lot of areas, that's a big deal. So it's a way of having a dialogue about how to change health and wellness without always talking about we need more doctors, we need more nurses, because there are other investments we can make that could change healthcare outcomes without having to train another doctor.
How can the Playbook help people who work in quality improvement?
It teaches us to be more thoughtful about questions we ask to get quality. There's a lot of great lessons in terms of addressing issues outside the clinical realm. We usually talk about the quality of the health care that's given, but it may be the quality of how you address non-medical issues that contribute to someone's ability to be well. It's not enough to say, did you take your medication or do you have insurance? But where do you live? How is your housing? Do you have a support system? What is your nutritional state like? Are you frequently hungry? What's your average diet like? It can't just be about, did you get your medicine and did you see the doc? And so we are starting to be more thoughtful about the questions we ask.
The Playbook contains 3 pillars or recommendations. One is titled Expanding Data Gathering and Data Sharing. What do you want people who work in healthcare quality to know or do about expanding data gathering and data sharing?
We're all serving the same people. And I think that needs to be clear. If you are unhoused, it is highly likely that you are also food insecure. And so why do we have to separate services into silos? First to the housing, you get your voucher, then you've got to go downtown to the food bank and get that. And then there's a whole other verification process. Once you understand that we're all serving the same clients, then you should simplify application processes so that information is shared across agencies, so that individual doesn't have to keep coming to show the same verifications, the same ID, fill out the same form. There should be, at this level of tech, transmitting information across agencies in a much more efficient manner. So part of that includes understanding privacy rules and what can and cannot be shared and how to get consent from individuals. But this will help you so that from one office, you should be able to access all of the services you need as opposed to having to go all over town to get your services.
And how would you assess the impact of expanding data gathering and data sharing? In other words, how can we best measure the impact of data gathering and data sharing?
It's not enough just to say, I know that you are food insecure, so I sent your information over to X agency. The next step is, did you go? Were they able to serve you? Did you get the services that you need? We have a habit in the public health field of handing somebody a flyer and saying, these are the services that we have available in your community. Now, we don't know what their capacity is. We don't know if anybody actually picked up the phone. We don't know if the person actually called. We're trying to get to, I gave you information about this individual. Did you call them? Did you follow up? Did you get them the services that you need? So it's really that next step, and not just here's information to get the data, but act on it in a way that it is providing the services that I'm hoping it ends up being like our telephones, where, I have an Android and any Android charger works for my phone. We'll be able to plug data into other agencies in a way that it doesn't matter what kind of data platform you have.
I asked other experts for their perspectives on the Playbook's first pillar.
I'm Michael Greer. I'm Director of Federal Affairs for NCQA. Around the first pillar, what Dr. Ford said about data when addressing health-related social needs is really important. But beyond the data, we have to have the network and infrastructure that allows us to be operational in utilizing data, making sure that we are able to connect and have the infrastructure that surrounds the data will allow us to move the needle on social needs. I really like what Dr. Ford said around nutrition. We know that when we address hunger and bring people nutritious food they need, we address core challenges that people face by just addressing nutrition.
The second of the three pillars in the Playbook is supporting flexible funding to address social needs. What does the Playbook recommend in that regard?
The Playbook talks a lot about how CMS is starting to have much more flexibility around addressing social determinants, much more focused now on, for example, meal support, more support for housing. There's been a greater understanding that if you're trying to address vulnerable populations, you cannot just talk about access to a doctor, because I can give you an appointment, but if you can't get to it, we're still not accomplishing what we're trying to accomplish. And so part of the flexible funding talks about grant guidance, which, from my days in public health, grant writing is an art. Once you get the grant, trying to accomplish goals within parameters of how you are allowed to spend money can be a challenge. For example, most grants require some level of community input. Well, most grants also don't allow you to feed people. So if you're going to bring somebody in at 5:00 in the afternoon to get them to talk about what they think is going on in the community, let's talk about community violence, come in and give us your thoughts, better be feeding them. Most grants do not allow for that. So you have to have a separate funder to supply the food. It just makes it more difficult to do the work. And so having more flexibility around how money is spent could be a game changer. Even with, reasonable parameters, there could be a lot more flexibility in how money is spent.
Here again, NCQA's Michael Greer.
To point two of the social determinants playbook, that flexible funding. I love that we're talking about more flexible funding. Now that we're able to utilize Medicaid and even Medicare dollars in new ways, it's really important because you have that network. So something has to sustain that network, and the resources and that flexible funding keep that network thriving.
The third and final pillar of the Social Determinants of Health Playbook is supporting backbone organizations. What is a backbone organization, and what does the Playbook recommend?
I think of it like a wheel with the hub. The backbone is the hub that may be supporting different community-based organizations, but the backbone is the one that manages the funds, manages the data. A good backbone should be making it simpler for agencies to serve the people that they need to serve. A person can come to an agency and say, I have this list of needs. And through the backbone, they're able to be linked to all of the services available to them in that community without having to go to each individual center. That wraparound service, one-stop shopping, where you go and everything that you need is listed. I've got a pharmacy issue. I've got a nutritional issue. Well, here's your food bank. Here's your pharmacy benefit, et cetera.
To pillar three, I like what Dr. Ford is saying and how she's tying in that access component to social needs and backbone organizations. To add to what Dr. Ford was saying about backbone organizations, We have to make sure that there are standards that allow organizations to reach across traditional boundaries because needs aren't siloed to a city, a county, or a state. Service providers provide need services in counties that are literally across the street, but they won't cross the sidewalk to provide services 20 feet over. That is crazy. We have to have standardization because whether that person moves 15 feet over and is in another county or in another city, they still have those needs. So if we have that flexible funding, we have the infrastructure, and we have the data, it's the trifecta we need to drive down our care costs and create a more sustainable healthcare system.
And when it comes to investing in backbone organizations, what have you learned about what works or doesn't work?
A statewide data platform is going to be more successful than a local one because they have more resources. Good governance, the leadership that understands what the goals are is a big one, but mostly the best ones is the data issue. Because if you tackle that, the rest will just fall into place.
This leads to an important point: the primacy of data. Sandra and her White House colleagues made data management the first pillar in the playbook for a reason.
Data's primary, and then the money, and then the people, which is the backbones.
Our listeners might be interested to learn that of money, data, and people, you're saying that data is the most important, the most difficult?
Certainly for public health, data is a huge gap. Georgia, during the pandemic, there were counties that were doing vaccination recording on an Excel spreadsheet. At least first 90 days to 6 months of the pandemic, we weren't even collecting consistently racial and ethnic data. So we didn't know who was dying. We just had numbers. It impacted our ability to respond most efficiently because we didn't know who to target. We can't operate in a large scale with folks who just don't know how to manage data. That's the biggest hurdle.
What would you like to see in terms of implementation of the playbook suggestions about data gathering and data sharing?
The first step to implementation of any kind of data process is standardization. We have to agree on what we're collecting, how we're collecting it, and then how we're going to share it. How do we respect people's privacy and protect the information that we're gathering? Then the next step is how do we take that information from the knowledge part into the action part? And then that becomes the data linkages. And I would love to see specific guidance on what does an optimal data platform look like? That's number one. Number two, long-term implementation, we've got to train up our IT folks, depending on where you came from. This is very new. There's got to be a lot of technical assistance provided as we learn this integration and interoperability, because folks are just used to collecting data, but not necessarily how to share it across platforms and across agencies. That is a huge part of the implementation piece.
What did you learn by working on the playbook? And how did that experience change how you think about social determinants?
Working on the playbook was powerful in that it taught me the power of a good story. I was on the health and veterans team at the time when I joined. The first meeting I had to pull together the social determinants playbook, it's called an IPC, an interagency planning committee. I shared a personal story about my pediatric life. I worked in a free clinic in East LA, and I spoke so much Spanish there that people started complimenting me on my English. I had a little girl that kept coming back time after time with the same ear infection. And, I speak your language. I didn't hand her mom a paper. I told her how to take the medicine. So we're not talking about a health literacy issue. The medicine's free. The care is free. Why does this child keep coming back with an ear infection? Well, weeks into this, I found out they were living in someone's garage. Amoxicillin has to be refrigerated to be effective. Would never have known that and would have treated her probably until she ended up having hearing loss. But more importantly, what if I hadn't asked the question? A, but B, I did ask a question. Now what? What resources are available? It was very powerful to me because it taught me, we need to be thinking about the whole person and not just the ear in this case, because I would never have done her medical justice until I knew what else was going on with her. We thought we were doing something because we were in a free clinic, but we weren't really addressing social determinants. That's the story I shared. That's how things started moving forward with the Playbook. And that was the beginning of, a really positive experience of people coming in and wanting to provide their thought and pull together different agencies to create policies on how we can address this.
What do you wish that people at the local level understood about people who work at the national level and vice versa?
I wish that national folks knew that there's nothing new under the sun, that there is so much brilliance at the local level. Rather than trying to create new ideas and new initiatives, they just need to go down to the local level, find the communities that are doing the great work and scale them. We could save a lot of time just finding these folks that are doing amazing work instead of trying to reinvent things. From the local to the national, I wish that local folks knew that you are competing with a lot of different interests. They need to really have their programs more built up before they start looking for federal support. From the government perspective, you sort of have to already be on the way to being successful. It's how do we incorporate more philanthropic funds? Locals need to be much more focused on philanthropic organizations to get some of their startup. The philanthropic world is looking for ways to contribute, and major companies have social justice requirements that we haven't really tapped into.
What do you find most people in healthcare don't know or get wrong about social determinants of health?
I think most people in healthcare are not aware of how many people are impacted by social determinants. Just because someone shows up in your office for their appointment does not mean that they are not food insecure, or they may come home to an empty home and not, be able to take care of themselves. Well, people pull themselves together to get to the doctor, but we don't really know what's going on with them outside of the office. And that's mostly because we don't ask. Part of social determinants is asking the questions. But if you ask the questions, then you need to be able to address whatever you find. We're not going to doctor ourselves out of the healthcare crisis. If we really want to address healthcare crises in this nation, we need to understand how are people living, what they're missing. We need to ask the questions that around how people live their lives. It's actually cheaper to give somebody a food prescription than it is to treat an amputee from diabetes. So if we ask the questions on the front end of what people need, we're better able to serve them from a clinical perspective. But in order to ask the questions, you've got to have the resources. We're not going to doctor ourselves out of the healthcare crisis, but if we work with partners and address this holistically, there's a lot of people that want to help, and we just need to identify them and support them.
I think that's a good place to leave things. Dr. Sandra Ford, thank you for being part of Quality Matters.
I appreciate that. Your questions were great. I get really passionate about this stuff because it's important.
That's all for today's episode. We will link in the show notes to the Playbook and to NCQA resources that can help you address social determinants of health. Go to ncqa.org/Quality Matters. I'm Andy Reynolds with NCQA. We'll see you again soon.